Hello, my name is Troy Bolden. I'm a senior nursing student at Cedar Crest College, and I'm presenting to you the Education on Lesbian, Gay, Bisexual, and Transgender Topics for Healthcare Professionals. And what led me to this topic was, as a gay male and a nursing student, I can kind of see both sides of thinking and standpoints. But additionally, as a gay male and having friends throughout the spectrum of LGBT, I can understand and empathize their fear when seeking healthcare. Are they going to be discriminated against? Are they going to receive the healthcare that they need and desire? But as a nursing student, I can see the flip side. I understand the importance of seeking care and finding a provider who will provide the care that ultimately you're looking for and that you need. So my clinical question, or my PICO question, was: in students and healthcare professionals, does the education on LGBT compared to no education on LGBT decrease healthcare disparities? And this is a significant problem for a variety of reasons. The first being that nurses are the most numerous healthcare professional in the medical field. So they kind of have to set the standard of care for patients when they first come into contact with them. Moreover, culturally competent care is necessary to provide equivalent quality of care for LGBT peoples within the community. And LGBT peoples actually have a high medical risk for evading even routine care because of heterosexism and the fear of facing prejudices. Nurses have the obligation to advocate for all of their patients, especially for LGBT patients and persons, and injustices they may face in a healthcare environment. And most importantly, the healthcare literature lacks the research, it lacks the theory, it lacks practice and protocols when dealing with the LGBT community. So nurses have the responsibility to set and develop a foundation for healthcare. And lastly, a lack of research and knowledge and theory is some of the most significant barriers of care to LGBT peoples. So for the literature search, I used ProQuest as my search engine, and the key phrase I used was healthcare professionals education on LGBT. From there, I set the publication dates between 2009 and 2017, and only scholarly journals were used. I limited the search even further by using Nursing and Allied Health database within ProQuest. And then from there, I used the keywords education, knowledge, and LGBT when I was looking through the titles of articles, and helped me narrow my search down. And from there, I read abstracts and introductions and kind of analyzed them to where healthcare professionals gain knowledge on LGBT persons and patients, and that yielded my 8 original results. And from there, I used Johns Hopkins and then Melnick to assess the quality and strength of my articles, which allowed me to limit my search to the final strongest 3. In Carabez et al., in 2015, the purpose was to measure the baseline knowledge and awareness that nursing students had on LGBT topics and issues. This was a secondary analysis of data that they collected from pre- and post-test surveys. And they found that students have inadequate language, knowledge, and skill set needed when providing care to LGBT peoples. In my second one, Gendron et al. In 2013, the purpose was to measure how person-centered and culturally competent care training changed awareness and knowledge and even comfort level among healthcare providers when working with LGBT patients, especially when working with older adults. This was a quasi-experimental in design, and they established the importance of providing compassionate and knowledgeable care, and especially culturally competent care, and how this should be a theme for all healthcare providers. Lastly, in Hardecker et al., the purpose was to increase understanding and knowledge of LGBT peoples, but also decrease discrimination of older adults and LGBT community. This design was also quasi-experimental as well, and they found that the training curriculum considerably increased the knowledge base and nurses' confidence when providing culturally competent care for this population. So the recommendations from these articles is to make education mandatory for all healthcare professionals that come into contact with the LGBT population. and to cap these trainings between 2 and 3 hours. That way, no one's zoning out and they can absorb all the information. Lastly next is to include a list of local and national resources and services during training that they can refer to, even after training, just in case, they have a patient that needs to refer to a different service. And this training should be provided in Spanish and other languages. That way, like with medical jargon, they can give the correct term when speaking with someone who doesn't have English as their first language. And in conclusion, education of knowledge or increase in knowledge allows providers to personalize and center care for the LGBT population. It also allows healthcare professionals to provide culturally competent care that ultimately removes barriers, which is what we're trying to do. And lastly, of course, nurses are a valuable advocate. Thank you.